I found out I was pregnant in spring 2020. It wasn't planned. I was on the contraceptive pill. So it was a bit of a shock, especially because my partner and I had just decided we wouldn't pursue a pregnancy at this point because with me being older, I was 35 at the time, and having endometriosis and previous C-sections, it did put me at a higher risk for complications. I'd also recently had a diagnosis of ME, which is chronic fatigue syndrome, along with lots of other things. So finding out was a bit of a panic, and I did check out what the options would be for termination, and as soon as I started looking it up, I knew it wasn't for me. Even now, knowing the risks that I was taking, and obviously what I ended up going through, I think, I've got my darling daughter now, and I would go through all of that again. I would, even though I'm still suffering, I would go through it all again. And that's the decision that I have probably selfishly made, but it was for me, and I don't judge anybody else's decisions when it comes to things like that. And I hope nobody judges me. I confirmed the pregnancy with my GP and booked in with the midwife. That's what you do here in Scotland. You confirm it with your GP, you book in with the midwife. They also work at the community part of the health centre. They'll get you what's called a booking in appointment, and you go along. They usually take bloods, take some measurements. They'll ask you when your last menstrual period was, all that kind of thing, the usual sort of pregnancy stuff. I have to admit, I didn't really get a good vibe off my midwife. It was the beginning of the pandemic, and I have to say she really wasn't handling that very well at all. And fair enough, but I didn't feel secure and confident with that situation. However, moving on from that, we confirmed that I was probably at about 7 or 9 weeks pregnant, and they had me scheduled for my 12-week scan and all that jazz. I had told the midwife of my concerns because I was a geriatric mother, which is because I'm not even sure what age you have to be over to be classed as having a geriatric pregnancy, but I was 35 anyway when I found out, and I felt old. I've already got 2 children. They are teenagers. So I've went along, I'm that mum, I'm having, a later life baby. And they treat you as that, let me tell you. So we organised all that, went along to my 12-week scan, everything was fine, baby was perfect, which was such a relief to hear. I don't believe in unnecessarily interfering with pregnancies. So although there was a lot of risk factors, I chose only to go down the route of blood tests. With my age, there's higher risk of congenital birth defects, as they like to call them. And I discussed this with my partner, and we decided that the risk to the pregnancy wasn't worth it, and we would rely on the blood tests and would rely on the scans. I'm lucky to say that my blood work came back saying that we would have been very low risk for congenital birth issues. and we were happy to go along with that. That was a relief for us. Moving on from that, we did get quite excited when it was coming up for the 20-week scan, because we would get to find out the gender of our baby. That's something that the National Health Service offers you. They don't say that it's a definite, it's, what the technician can see at the time. The majority of the time they're accurate, and you can kind of pretty much say, yeah, it's a boy or it's a girl. Again, I want no judgment on my terminology here. I'm going by what the radiologists and I cannot remember the name for it, the people that do the scans, sonographers, possibly. That's the terminology that they use. It's a gender scan. So the 20 weeks we're looking for abnormalities, and unfortunately they did find a couple. It was at that point they discovered I had placenta previa. Placenta previa, it's a problem that can occur during pregnancies where the placenta is completely or partially covering the cervix, which is obviously the entrance to the uterus and the exit for the baby. You might hear my cat because it's just came in. So the placenta, it usually develops normally inside the uterus, and it'll adhere normally to the uterine wall, and that's what provides the baby with everything it needs. It forms blood vessels, and that's how baby grows. Now, if your placenta is covering your cervix, as you can imagine, you can't deliver naturally. If the cervix is only partially covered, which is what they led me to believe at that point, they like to do a bit of a time waiting game. And what they do is they say, as baby grows and as your uterus expands, the cervix obviously stays where it is, but the placenta may adjust itself slightly as the uterine wall stretches. It may pull it further away from the cervix to a safe position for delivery. It's very rare that that happens, because it's not like the placenta is actually moving. It's just with the stretch of the uterus, sometimes it can leave more of a safe space for baby to be born. I was instantly worried when they said your placenta's covering cervix, because a couple of years before that, a close friend of mine's had the same situation, and I was fortunate enough to be her partner in going to her appointments. And because pregnancy actually fascinates me, it's such a miracle and it's so amazing that we can go through this, I was right in there asking the specialists questions, looking at the scans, watching everything that's happening and taking it all in. And I knew that it was quite a high risk situation, especially considering the way that my friend's labour progressed. She did have a bleed, and she did end up with an emergency caesarean section, and quite dramatic and life risking situations. So I've instantly panicked. Blood has drained from my face. I'm feeling a little bit shaky at this point. The sonographer, which I'm going to have to check for the next video, I think that's what they're called, she said to me, don't worry about it. We'll book you in for extra scans. They'll keep an eye on it. I had previously said I was probably having a C-section again anyway, because I'd had 2 before. My first baby was an emergency caesarean. She was what used to be called double breech, so she was like upside down and back to front as such. Not a desirable position for a first time labour. And I was in a lot of pain as well. I had that thing where your pelvis loosens too much, so it's quite painful anyway, and they didn't want to put me through that. It's the first time mum, I think baby was becoming a bit distressed, so it was an emergency caesarean at that point, which at that stage of my life was really traumatic, and that stayed with me for a long time. And with my son, which was my second pregnancy, I was determined to do a VBAC, which is it's basically having a vaginal delivery after having a caesarean section. And until 2 weeks before his due date, that's what I was doing. And then I began having nightmares and panic attacks because I hadn't really dealt with the situation from my first labour. And again, because I was a young mum at that point, I was in my early 20s, I was probably a bit less vocal than I am now. I was a bit shy on saying, actually, I'm not comfortable with this pregnancy. And they did do a lot to reassure me, I have to admit, they really did. They'd done extra scans, they double checked, things were perfect. It would be a textbook pregnancy and labour as far as they were concerned, and birth. Unfortunately, my anxiety was through the roof, and although I didn't know at that time, I was suffering from post-traumatic stress disorder in relation to the birth of my first daughter, and it's only resurfaced as my due date approached with my second child. But he was a straightforward, planned caesarean section, which I have to admit, given the situation, was definitely the way forward for me. It meant I was able to organise childcare for my daughter, who was still a baby herself at that point, and I could actually deal with the fact that I was going for surgery rather than worrying about it. It just worked better for us, it really did. Had they picked up on how distressed I actually was, I would have been able to get PTSD treatment at that point. We just didn't know. They just thought I was being an anxious mum, worrying about the labour because I hadn't done it before, which is fair enough. So after all that, I was really worried. I knew that I was probably having a C-section with my third baby because it's kind of recommended, especially after you've had issues before. And unfortunately, I have endometriosis. It wasn't within the lining of my womb, it was the outward wall of my womb and the surrounding abdominal tissue. Had small lesions and quite a lot of adhesions, which is scar tissue from the endo. I also have it on my ureters, which are the tubes that go from your bladder to your kidneys. And I also have it thoracically, which is mostly around about my diaphragm and rib area. So these were risk factors for the pregnancy, and I knew this at that point. It was really just going to be a waiting game for the placenta, see what would happen with that. But also at that 20-week scan, I had the lady who was checking baby in development was starting to get a little bit stressed out, and I could see this. Basically, she couldn't find the fourth chamber of her heart. So of course I'm panicking again. I'm thinking, oh my goodness, she's got, because at this point she told me it was a girl, so she's got congenital heart condition. Is this survivable? Can she have surgery when she's born? Will they make me have a late termination? Will they recommend it? Will I have to give birth to a baby that's going to die or will possibly die at late stages of pregnancy? All these things were going through my head at this point, and she's trying to reassure me. She's saying, don't worry, I think it's just positional. We'll get you in next time, and surely we'll likely find the fourth chamber or valve. It was one of them bits, maybe the valve and the chamber, who knows. Anywho, moving forward to the next appointment, which I think was a fortnight later. because things were quite busy and the hospital was quite locked down with COVID restrictions, I was going to these appointments myself, which was quite tough, especially when they're looking for defects and you know your placenta's not where it should be. Unfortunately, the woman that was doing it that time couldn't find the valve or chamber either. So they've said, right, what we'll do is, again, we think it's still just positional. We'll book you in again, but we'll also book you in for a specialist paediatric cardiologist, I believe is the term for who I was waiting on checking me out. So I've gone home that day, absolutely stressed out my head, and you know, my partner's surprisingly positive when it comes to quite worrying things, and he's like, oh, you know, just listen to them, they're saying it's probably positional. If it was something more than that, surely they would speak to us by now. So I'm trying to stay calm, trying not to worry anybody out about this, trying not to stress myself out because I was pregnant. We finally get to see the specialist. Now at this point I think I am about 26 weeks pregnant. So I am past the threshold for legal terminations, which again would never have been about me because I would have loved my baby no matter what happened. It was more, do I give birth to a baby that's only going to survive for a day or two? Is it kinder to end that life now? I had all these thoughts going through my head, which, you know, it's not like me. I might be harsh and unforgiving about certain things, particularly sort of political and social type things, but when it comes to lives, I'm very much wanting everybody to be happy and pain-free, and that's just how I am. So for me, I was thinking about this little life that I was carrying within me, and was she suffering, and how do we help that? And of course, the positive side of me is thinking, you see all these miracles, people are told their children are going to have X, Y, Z congenital defects. I hate that word. And then the baby's born and they're completely perfect. There's absolutely nothing wrong with them, or it's not been as severe as they thought it was and they survive. But then you have the cases where mum has to go through this awful labour and then they have to grieve a life that they made. And I know a lot of women that have been through that, and I don't know how they go on in their daily life, but they're strong. So I had all these thoughts going through my head, and as you can imagine, it was a really stressful time. And honestly, there was no support for that. None. No support for that at all. Nobody once said, do you want to speak to somebody about this? And I was barely seeing my midwife because of the pandemic. The appointments were far more stretched out. And then, unless they needed to do a physical check, it was on the telephone. How are you feeling? Great! You're fine then. And having had 2 babies before, I knew that wasn't really exceptional care at all. It was the very basic, which I know is more than some people get, so I was grateful for that, but I was frustrated as well, especially because, well, to me it wasn't normal. Nothing was normal about this pregnancy, and I mean, I was suffering. I had lots of sickness and dizzy spells, and was very breathless and puffed out as well. And I actually ended up admitted into hospital. I think it was while I was waiting to see the paediatric cardiologist specialist person, because when I did see my midwife, she actually panicked and thought I had COVID because I was having such severe chest pains, dizzy spells. I just felt awful. I ended up admitted for 3 days, I think. And in that time frame, I referred to myself as being kidnapped because all my tests were coming back fine, every test, and of course that was an awful time too, because for the first day and a half I was completely isolated because they thought I had COVID. They had to wait on tests coming back. Unfortunately, I was pretty much held down, not by hands, but, well, yeah, my nurse had to, with my permission, unfortunately, I had to allow her to hold me still so she could swab me. I was starting to get really distressed at this point. There was so much going on and I hadn't had anybody to speak to about it. And then I don't do well with procedures. I do get a little bit stressed out about them. I panic a little bit, and that's perfectly normal. The panic goes to a level that isn't normal often for me, and that's where distress sort of sits in. So unfortunately that stayed with me a little bit, and the poor nurse, she came back, because I refused the test several times. I said, I can't do it, I'm sorry. I'm working up to it, and she's like, right, well, my shift ends at whatever time, I'll come back. She says, if I don't do it, the next nurse is going to have to come in and, basically they were badgering me until I gave consent to do a test. They really needed the other side room for somebody else, so they wanted me on the ward if I was well enough as quick as possible. And I'm still feeling terrible at this point. I'm waiting on other tests coming back, and eventually the COVID swab came back negative, which we all knew, but, it was the process that they'd put in place. So I'm on the main ward, and I'm in a room with this other girl, and she is very, very poorly. This girl is very sick, very dehydrated, and I'm thinking, why am I here? Because I'm fine, I'm just really tired. The chest pain, yep, I get it. Maybe it's just anxiety and stress, what's going on? I ended up having a cardiologist check my heart out because they were really worried about that at that point. I had to have a CT scan as well. They wanted to check for a pulmonary embolism, which I think in layman's terms is a blood clot of the lung. My CT scan, it came back inconclusive because it was slightly blurry. I think being pregnant, obviously, I was still, but my baby wasn't. So that was a concern for me, because you are taking a risk of radiation for your baby and for yourself, which can, lots of things can increase your risk of cancer at that point. So having that scan has, while my breast tissue is growing and developing and I've got these hormones, that can increase the chance of breast cancer by quite a high percentage. And it can also increase the risk of cancers developing within my baby, because she's growing, she's tiny, there's not that much protection. Another concern, another stress for me to worry about, but with the grander scheme of things, if it had a pulmonary embolism, then obviously they needed to know. Like I said, it came back inconclusive, but the cardiologist says my heart was absolutely perfect. And after some more blood tests, it came back that my iron was incredibly low. So that would explain why I was so fatigued and why I was starting to feel a little bit very down. I wouldn't say like depressed, but I was suffering with the anxiety of the pregnancy not going well at all, not going comfortably at all, and my body just wasn't coping with it. And I was still working at this point. I was still working, I had my own business, so I was still going to work and standing on my feet quite a lot of the day. My clients were very, very nice and allowed me to sit down and take breaks, and I had longer times between things, but I was still, I had to bring in money. I was having an unplanned pregnancy. at the beginning of a pandemic where we knew our businesses weren't going to survive at this point. I was in the beauty industry within a hairdressing salon, which we all know they got shut down, so it was just a stressful time for everybody. I finally got out of hospital with a huge... I had to beg them to release me, actually. I did say to them that, I'm leaving tomorrow, you have to get my discharge papers together. So they organised my prescription for a really high dose of iron. And basically that I was to be on complete pelvic rest at this point and to rest as much as I could. And I was to reduce my hours at work. So I think I cut down to about a day. I think I cut down to a day where it was just enough to keep me ticking over. I was able to pay my bills. And it was getting me out the house for a day. A day where I could chat to people and not be necessarily stressing about things. So after that, I'm back home, I'm happy as, I'm sorting out baby things, buying wee cute items, going into the loft and getting down things from my first and my second pregnancy, sorting them out, anything that was neutral or girly, that's what we were keeping. I was washing them all up, doing that thing that we like to do, the nesting, planning stuff. And then my specialist appointment came along to check for baby's heart, and she's done my scan, and she says, oh, instantly found it, absolutely perfect, nothing to worry about. She's like, do you know that your placenta's completely covering your cervix? And I says, oh, well, they did say placenta previa, but they were hoping it would move, and she's kind of shook her head and says, no, when's your next appointment? And I said, oh, it's like 2 weeks' time or something like that, to see if placenta had moved. And she's like, right. She says, it's not my place because I'm here for cardiology, but you know that it's probably not moving. And I did say to her, I was like, yeah, I know. I'm having a section anyway. I'm just glad baby's heart's fine, and I'm happy with that. And she was like, right, that's fine. I'm going to put some additional notes on your file, blah, blah, blah. And then her junior doctor done some extra checks and things purely because he was training. He just wanted to, use me as a learning experience. So he's like taking measurements of everything, and he's like, yep, everything's perfect apart from your placenta. So I'm thinking that's cool, no worries. I'll wait on my specialist appointment for my placenta. And I went back to my day-to-day for the next fortnight. I was lucky enough that my mother-in-law could take me through to my hospital appointment in Edinburgh for the specialist. And I'm sitting in the reception and I'm drinking more and more water because obviously you need to have a full bladder, and I couldn't sit in a car with a full bladder, so I'm topping up on water. We go through for the scan. She says, oh, we can't, your bladder's not full enough. And I'm like, right, okay, so I've drank 3 pints of water at this point. How is my bladder not full enough? She says, well, sometimes, apparently when you're stressed, your body, it does something differently with water. So I don't understand what happened with that. But she says, okay, if you've got time, can you go out to reception? And I'm like, if I've got time, I'm here for a specialist appointment. I'm here all day until you can scan me. So I get my scan again, and she's like, right, there's still not very much water in your bladder, but I can see. So she's having a wee look, and then she says, actually, we need to do an internal scan now as well, which I wasn't prepared for. And after having some trauma with my first pregnancy, I do have anxiety issues with having internal examinations. I have always went for my smear tests and all that jazz. It causes me great distress, but I do these things that with the right information at the time, I make a decision what I think is best for my health, and I've done all this. So I hold the hand of my mother-in-law, who now we're having a really good bonding session because she's holding my hand while I'm having an internal examination done. And I found it very painful, I have to admit. It was very uncomfortable. I didn't like it at all. And from what the person said, the specialist said, she's like, right, definitely have placenta previa. It's completely covering the cervix. It looks secure because you can have ruptures when your placenta's right over, which is why I was on complete pelvic rest. And I had to take it easy. And she actually said to me, no, I want you to, finish up work now. You need to go on maternity leave now. She says, we're going to book you in for a MRI. The appointment will come through within the next couple of weeks. That'll give us a clearer image of what's going on here. So I went home, tried to explain to people the situation, and of course from what my friend had gone through before and from all the time I'd spent researching, because I was starting to panic at this point. So I was basically digesting every piece of information that I could find on placenta previa and complications. I didn't need to worry about my baby anymore.